This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Vision Center in Oshkosh, and we're going to be talking with Dr. Amy Treichel-Brandt. We're going to be talking about various eye conditions and what you can do to take better care of your eyes. Well, thanks for joining us today. A lot of people don't seem to have eye trouble, but how often should they actually get an eye exam?
Well, I recommend that most normal, healthy adults have an eye exam at least every 2 years, and then more frequently for children up to maybe age 18, also for contact lens wearers, for the elderly, maybe around age 65, and then anyone with a diagnosed eye problem such as cataracts or glaucoma. Diabetics should definitely have a yearly eye exam. So it kind of depends on what sort of problems are at hand and maybe the age of the patient.
I think when a lot of people think about an eye exam, they want to be 20/20. What exactly is 20/20?
What 20/20 refers to is what normal vision would be. 20/20 means that you can see at 20 feet what a normal patient should be able to see. 20/40 is twice as bad as that. So a person would have to be 20 feet from what a normal person could see at 40 feet away. Or the 20/20 person can see detail that's half as big as the person who's 20/40. So it's a way to measure how good or poor our vision is.
And when you start talking about eye issues, astigmatism is something that people sometimes have to deal with. If you have that issue, can you still wear contacts?
Right. Astigmatism is a very common problem. It goes along with being nearsighted or being farsighted. Astigmatism really refers to the shape of the eye, and specifically the shape of the front of the eye, and to a lesser extent the lens inside the eye. When the cornea or the front window in the eye is a football shape rather than a round basketball or spherical shape, that creates astigmatism. So it's like there are two parts to the prescription for the different curvatures of the eye. And it's corrected for by glasses, and it also is corrected for by contact lenses.
Some people, I would imagine, try to correct that themselves by purchasing maybe over-the-counter reading glasses. Does that create a problem?
Well, yes and no. Over-the-counter reading glasses are really just magnifying glasses. So there's not anything wrong with them per se, but there are a lot of things that they're not going to correct. Astigmatism is one of those. I think the biggest risk with over-the-counter glasses is someone just purchasing them, thinking they can't see up close, getting the glasses, and then not having an eye exam. And then we miss the fact that there's underlying glaucoma, or they're not working well because the eyes have a difference in prescription between the two eyes, or there is astigmatism and they're not going to help with that. So many times after an eye exam, if I find that a person is seeing well at a distance and only having trouble seeing up close, I might recommend them maybe over top of contact lenses. But the important thing is not to only go that route and forego the eye exam.
Now, it might be easier for an adult or a young adult or an older adult to figure out you have an eye issue. But if you're dealing with children, how do you deal with the children? Especially, what are some of the disorders that you have to deal with when it comes to children's eye problems?
With children, I think one of the big things is they don't recognize the signs of a problem. Even some adults don't. But especially for kids, they may not know the difference. That's all they're used to. So they don't know that things are supposed to look a whole lot clearer. So some of the most common conditions with kids are just the refractive things, myopia or nearsightedness, farsightedness, astigmatism, things like that. But also lazy eye, where one eye is turned in or turned out and may not see as well as the other eye. And that has to be treated with glasses and oftentimes with patching to force them to use the eye that's not working well. So the binocular vision disorders, the eyes working well together, those are some of the important things. Eye health problems seem less common in children, apart from things like pink eye and eye infections, things like that.
Now, when we're talking about eye health, I know one of the things that you will typically do is dilate an eye. What's involved in dilating an eye, and why do you do it?
When we dilate a patient's pupils during the course of an exam, it's really to give me or to give the eye doctor a better view of the inside of the eye. It involves eye drops that'll make the pupil large, cause a little blurry vision up close, a little light sensitivity, but through that larger window into the eye, I can much better check for the eye health conditions like cataracts, signs of glaucoma, signs of diabetes, high blood pressure, macular degeneration in older people. So it's an important part of doing the best check for the health of the eyes.
You mentioned glaucoma. How do I know if I have glaucoma?
Glaucoma is one of those things that you very likely would not know you had if you weren't having an eye exam. It's called the silent sneak thief of sight. It doesn't necessarily cause any symptoms until it could be pretty far advanced. It won't necessarily cause eye redness or blurry vision, but gradually the pressure in the eye is building, damaging the optic nerve, leading to loss of peripheral vision and eventually more vision if it's not treated.
Do you have to be more careful if you're dealing with diabetes?
Absolutely. Diabetes is the leading cause of vision loss among adults in the U.S. So it's a common thing that I'll see. I'll see diabetic patients every day and do an eye exam looking for the effects in the back of the eyes, mainly effects in the blood vessels, hemorrhaging, swelling of the retinal tissue, abnormal new blood vessels, many effects that diabetes can have on the eyes.
I know seasonal allergies are a big pain for me. Eyes get so red and puffy. Is there anything we can do besides seeing a doctor?
Well, absolutely. Allergies are a common problem, especially seasonally, but even all year long. Indoor allergies, outdoor allergies. There are great prescription antihistamine eye drops. There are several over-the-counter antihistamine eye drops that work well too, but also avoidance of the offending agent. Cold compresses. Cold has a numbing effect and really helps a lot too. Oral antihistamines are another treatment.
All right, before we let you go, is there anything we should be doing to really help promote the health of our eyes?
There are many things that a person can do. Having those routine eye exams, I think, is the most important thing, but also common sense with contact lens wear, removing those lenses and replacing them on schedule, wearing safety glasses if we're doing any hazardous activity. Nutrition is really important with the eyes. There's recent studies show the benefit for certain vitamins and minerals and other things with our diet. Lots of things we can do preventatively.
Better than the alternative where you have to come in for treatment then. Prevention a little bit better than that.
Absolutely. Early intervention is always key.
You bet. Okay, well, thanks for taking some time with us today.
Thank you.
If you'd like to know more about eye care or to schedule an appointment with Dr. Treichel-Brandt, you can call the Aurora Vision Center in Oshkosh at 920-456-2000. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.